not really vigorous.
Okay.
Like
Okay.
Workout.
Light exercise.
Just walking
like
out.
trekking could also be.
Even taking walks.
Okay.
Start around your neighborhood, increase it, begin to prepare because it helps the mood.
Yes.
Okay.
Yes.
Okay.
By the time one exercises, there's this release of feel-good hormones
Okay.
that helps the person to relax. Then some people that practice yoga, this relaxing exercise also helps. So all these lifestyle changes, they will really, really help. You know, apart from the hormone therapy, which I said earlier that could apply to very, very extreme cases because we have side effects of that.
Exactly.
So that's why
Personally,
we
I
have
don't
to
even advise
yes,
that hormonal therapy.
we have to be very careful.
You just have to accept that this is a period in your lifetime that must come. So why are you postponing the evil day? Because most of the time when you do that hormone therapy, there's possibility of the woman, the menstrual period returns back.
Okay.
It's possible for some women.
Okay.
At times it may not be.
Okay.
But what of, are you not postponing an evil day?
Postponing an every day, exactly.
So why not just
something
accept
that
it?
is certainly going to
Going
happen,
to
whether you
come.
like it or not.
Exactly.
It's certainly going to come in. Okay. So that automatically, that means this hormonal treatment is not something you can do over the counter.
At all.
You can't just go over the counter and say you're buying some estrogen tablets.
It's
No,
not
it comes in pills, patches, gel, and all that.
Okay.
Okay? It comes in that, but it's not a very popular way of managing menopause. Okay. Lifestyle changes, non-hormonal treatments are better.
Okay.
Then we are asking whether menopause could be reversed.
Yes. If
It's a normal aging process.
must come.
Okay? But now there are treatments now abroad that somebody who has been in menopause for over 10 years, they start taking, yes, I've heard it, taking treatments, hormonal injections and all that, just to be able to bear a child. It has happened, but it has a side effect. So by the time we check and weigh the pros and the cons, you understand, to set back your biological clock again is something that comes with some degree of risk.
okay.
Okay? Not that, because some people have been able to do it, maybe to have a child for whatever reasons, but it can be done permanently.
Okay, can I ask this question that just came to my mind now? For someone who has stayed years in marriage and never had a child, and the person is already attaining menopause, can IVF help such a person conceive? Can such a person conceive via IVF?
Definitely.
Is it possible?
It's possible.
It's possible.
It's possible.
We've had a case of a 65-year-old woman, yes, that had IVF treatment
But
and
she's
delivered.
no longer producing eggs.
That's why I'm saying that.
So
That
the
is
eggs-
part of the reversing. Is like
Okay. Okay,
trying
the system
to,
will have
yes,
to be, okay, they try
to
to
an
reverse
extent,
the system
yes,
to get
be
it to
able
produce
depending on whether it's an egg that is from a donor.
Okay.
And that's
It
most
could
of the
also
time.
be egg from a donor.
donor,
okay.
Yes.
Sperm
Okay.
cells could be
Or
from
her
donors.
own. I think it's more difficult.
For her
Or-
own
yes,
eggs.
for
As
her
of that
own
time.
eggs.
Yes, because
That's what I'm
my-
thinking.
that's
I'm
what
not an
curious.
expert in that, but what I'm saying is that reversal has its consequences.
Okay.
Lots.
Now, for whatever reason why menopause wants to be reversed, you have to weigh and see, is it worth it?
Mm.
Is it worth it? Okay? Then if you find out that it's worth it, or maybe it could be a woman that lost her ovaries due to cancer when she was very, very, very young.
Young.
And maybe the uterus is still intact, okay? And now has somebody donate egg and wants to create an environment that is okay for the baby, you know, something like that. There are so many cases and complications that could come up.
What about if the
Okay.
woman feels, I don't mind, just reverse this thing. I want my eggs, I want my child, I don't even mind giving birth to this child. Some people can have that kind of mindset.
Yes.
Child, let me just have this child. Even if I die after this child is born, just don't mind. I just want
That's why I said you weigh the pros and the
pros
cons.
and the cons
Yeah.
and then make your choice
And make your
yourself.
choice. And it will be written, documented. In the course
Case
of the
of
treatment,
anything.
this, that. That is where the medical ethics come in, with the legal.
Okay,
The legal, the
let's
law,
let's
and
look
the
at
ethics.
the husband's place now. We've been talking the woman. And this menopause, commonly is expected that the woman at this stage is in a husband's home. Even if not in the husband's house, you have family members. Would this affect relationship in any way, either with husband or with members of the family, for sisters who are not married, members of the family? Will it in any way come into play in the relationship, how you relate with your husband, attitude-wise?
Yes, because there is this irritability. one of the signs and symptoms of a menopause.
Okay.
The woman just wake up one morning, just feel irritated. Ah, why did you put this here? Who did this? You know, just start shouting. It's normal. So, but where there is understanding, when the man knows that, okay, my wife is about 55 years and menopause are setting, even the children, like me, when I attend my own menopause, I call my husband and say, Daddy, this woman you are seeing is no more as agile as you used to see me. All these symptoms are going down. Even the area of sex, everything. And even though they say we should not talk about the inner room, but at times I say, look,
The other room.
yeah, the other room. I'm no more interested. My husband will just look at me and laugh. I say, oh, is it because I'm saying it? But after some time, I have to talk to myself and say, no, I have to let him know. And immediately I let him know. And I also let my children know. I say, look, your mommy can be so forgetful now. If I drop this thing here and I'm asking you, if you know where it is, it's better you let me know.
It affects relationships.
It affects
Yeah,
Just
it
like,
affects.
yes, just
Okay.
like what
It
said,
affects
directly with the spouse.
Exactly.
Okay, when it comes
Likewise
to
with the
libido
children.
changes,
Okay.
Exactly.
when it comes to irritability,
With the children.
mood swings.
children.
Mood swings.
No, irritability could also be with the husband.
The husband.
Maybe a normal conversation, the woman will,
Just flare.
will respond with a back
Exactly.
instead of talking.
Okay.
Okay, so it also affects, okay, that's how it affects the family members
Family
too.
members.
Okay.
Okay, so if you begin to understand that, look,
That this person
noticing
has-
some changes, it takes an understanding man to say, okay,
Exactly.
my wife is no longer 20-something as before, and all that. I expect these changes. Okay, how do we now do it? In terms of sexual relationship, do we get gel,
Okay, lubricants?
lubricants? Okay, do we talk to ourselves? Do we, there are some very intimate things that need to be discussed. Instead of just taking it out or going out there to go and look for a younger
So
Exactly.
girl.
that means communication is very,
Very, very
vital
important.
to menopausal
Very,
stage.
very, very,
so
very.
you need to communicate.
Yes.
The man needs to understand. So this education, this knowledge now we're sharing, should the men be part of this knowledge? Since they are our husbands and this affects them directly, should they be equipped with the knowledge of menopause as to prepare to when this hits and then so that they can know better how to manage the woman? Is it necessary? Is it important for the man to
Definitely.
Very
acquire
important.
knowledge?
It takes two to tango.
Exactly.
So if you notice that your partner is no longer the way she used to be, it's a cause for concern. Some that are not very patient, they move out. Okay? That's what you hear when you talk about middle-age crisis. Crisis is like men are looking for younger women
And then
because the one...
you now see a home of 30 years in marriage breaking
Yes.
up.
Breaking up
Okay.
overnight.
Then there's another thing we missed out a bit. That's talking about joining a support group because some women do not know that other women too are having these
The
issues.
same issue. Yes.
You understand? You will now see, okay, this person is having this issue too. Okay, it's not only me.
It's not, I'm not
So
alone.
this support, you support yourself. Okay, how did you do in the area of, like maybe in the sexual area? How did you handle it?
Which brand of lubricant did you
Or
buy?
what- or how
Which
did you
one
do
is
it?
better? How did you?
Or is it that you change the time of your meeting from night to morning or morning to afternoon? Things like that.
Asking questions.
Joining
Very
support
important.
group
Yeah.
and supporting yourself also helps the woman.
Sorry,
to,
I want to ask this question. This, I see people buy tiger nuts, buy coconuts, ma, and I hear people. 5 minutes. Oh wow, we're out of time, so I'm going to leave. I'm going to leave.
And I want
It's
to also-
working. It's working for them.
There's something
You
I
know,
want to
everything
say.
about mindset.
There's one
If
thing
you
I
believe
want
on
to
something,
Yes,
it
because
works
I
for
see
you.
people chew them, man.
That's what they say, that it helps them to increase
Some
their...
people are asking whether men exhibit
Exhibit
menopause.
menopause.
There
It's
is
not
andropause.
possible.
There's andropause in men.
There's menopause in men.
Andropause. We call it andropause.
Andropause.
Andropause. in
It's
men.
not called menopause because
Okay, it's
men there is
andropause.
menstruation.
Okay, menstruation.
Yeah.
Andropause. Yes.
So
They also experience some of these things that we women
these
also
hot
experience.
flashes, this
Yes.
things.
Unable to go the usual way. If the man has been going every day, before you know it, there's decline.
Okay.
There's decline. And at times,
It mostly
But it's
affects
only
their
that-
libido.
yes.
Okay, their own cases mostly,
Mostly
their
on their
libido.
libido.
So you discovered that, okay, now things can go either way. If the woman on the other side libido went high and the man on the other side, libido went low.
And I would like to say that that's why you see that there's increase in aphrodisiac, taking of this
All this,
aphrodisiac
Okay,
in
like
men.
all these,
And yes,
sexual enhancement
enhancement drugs.
drugs.
And it has its own side
Which is
effects.
not
We've
all
heard
that
so
too
many
good.
cases of people, you know, dying or having cardiac arrest, and
Yes.
yet people are still going that
Yes,
way.
I heard
Okay.
for Viagra, I heard
Viagra.
leads to heart attack.
They
I think
have
I was
side
reading some
effects.
studies and then
They have
like,
side because most of these
Serious
men,
side effects, and that's
well,
why we don't
most,
encourage it.
I can't speak for all. Most of them are not that fit. You understand? So you find that the
Like
heart,
they want to maintain
yes,
themselves.
the heart, so exercise still
and
comes
they
in.
actually don't know that they're
Lifestyle,
actually going through which is it. And you know, it's like the only knowledge out there, the only thing everyone knows out there is that menopause, woman. So like the men on, no, like I'm just hearing andropause.
andropause.
I'm just hearing it. I've not heard it before. So I'm sure this is also with the men. A lot of men don't even know that they too get to this
Lifestyle
point.
changes can also help.
Can help.
Just the way, yes. Exercise, diet, good food, and all that can help. Okay?
Okay. Okay. You menace. Okay, viewers, you've heard that. Men too exhibit andropause. Yes, not menopause, but andropause. At this point, I want to say thank you, doctors and nurses in the house, for helping us do justice to this topic. I want to believe that we've all have learned something tonight, and we've taken away one or two. If you're in the younger age, you should be preparing. You should know what to do. Don't wait until it hits you. And if you're already there, you already know what to do and how to deal with these things as they come every day. Thank you, viewers, for joining us tonight. Next Monday is another day. Please make it a day with us. Thank you and good night. God bless you.